unmute. Welcome to those of us, man, off to a bad start today. Welcome to those of you who are just joining us. We're going to give people a few minutes to get logged on, so please just hang tight. Welcome to those of you who are just joining us. We will get started in another minute or so, so just hang tight. Welcome to those of you who are just joining us. I'm going to give it 30 more seconds for people to log on, and then we'll go ahead and get started. All right, I'm going to go ahead and get started. Hi, everyone. For those who have not met me yet, my name is Hilary Godwin, and I have the honor and pleasure of serving as Dean of the UW School of Public Health. Thanks for tuning in today. We are shifting away from COVID for this webinar and instead focusing on talking about the progress that we've made as a community towards achieving the goals that were laid out in our new 2020 to 2025 strategic plan, which we launched last July. And joining me to present on where we're at in our strategic planning implementation process are Stephanie Farquhar, our Associate Dean for Evaluation and Improvement, Carey Farquhar, who is our Vice Dean for Education, Uli Rowhani-Rahbar, who's our Associate Professor of Epidemiology and soon to be Professor, Uli Haller, Assistant Dean for Finance and Administration, Megan Ingram, Associate Dean for Advancement, and Victoria Gardner, Assistant Dean for Equity, Diversity, and Inclusion. Before we begin, a couple of housekeeping notes. We use the Q&A function to post questions. So if there are resources or anything that you want to share, and I'm guessing that folks will be doing this along the way, if you want to provide links for everyone, you can put those in the chat. If you have questions for the participants, please put them in the Q&A box. I'd also like to begin today's webinar by centering ourselves in a land and labor acknowledgement that was written by our own Tess Matsukawa, who's an SPH staff member and one of the advisors in our Public Health Global Health program. It's vitally important for us to know the longstanding history of where we are and what has shaped the context of the land that we inhabit. I'd like to acknowledge that even though we are gathering via Zoom, we are doing so on Indigenous lands. I'm calling in from the Indigenous lands of the Suquamish people. And in Seattle, where many of us live and work, we acknowledge all of the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. This is land that was stolen by European colonizers. land that was stolen from the Duwamish, who are still here and are continuing to honor and bring light to their ancestral heritage. This country as a whole was built on stolen land with the exploited labor of enslaved African peoples, as well as the exploited labor of unpaid Asian and Latinx peoples. These acts of colonialism, white supremacy, and anti-Blackness are the history of this country, as well as our ongoing and current reality. We honor and recognize the lives, knowledge, and labor of Black and Native peoples in the past, present, and future. There is an immense need for action within the School of Public Health and all other systems and organizations that is centered on liberation for Black and Indigenous peoples. This requires an understanding of the context of where we are and our own positionality within those systems, as well as a dedication to justice-based action. And it is in those contexts that we center our discussions today. I also want to acknowledge that we're approaching the 1-year mark of the murder of George Floyd in Minneapolis. Floyd's violent death at the hands of now former police officer Derek Chauvin reignited a movement for racial justice that has touched every aspect of life on a scale that many say has not happened since the civil rights movement of the 1960s. Although the guilty verdict in Derek Chauvin's trial in April brought some semblance of solace to George Floyd's family, friends, and community, and to the country at large, we know that there is still so much work that we need to do. The weight of this work is not only reflected in the continued oppression of Black people in this country, but also in the atrocities experienced by oppressed and marginalized people and communities around the world. And that certainly has been visible in the recent weeks as we've seen continued tensions in the Middle East, and our hearts go out to the peoples who have been so severely impacted by the conflict in Israel and Palestine. The work involved in rooting out racism and other forms of oppression is core to our values at the University of Washington School of Public Health, and central to our work as public health professionals to promote good health for all. That's why you see equity, justice, and anti-racism as a through line for our 5-year strategic plan. It encompasses and supports all of the work in the plan, as you will hear about in the hour to come. So I wanted to thank everyone who has played a role in the strategic planning process. We had amazing facilitators from Pyramid Consultants, and also our own faculty and staff, some of whom you will hear from today. I want to thank everyone who responded to the surveys, who took part in focus groups and town halls, and otherwise shared both their opinions and also their ideas for how we should adapt in the future. We would not have been able to accomplish any of the milestones that you will hear about today. I'm obviously having difficulty speaking today, sorry. That you will hear about today if it had not been for all of your work, support, and contributions. It has not escaped anyone's notice that the work on the strategic plan during this last year was completed under extraordinary circumstances. We talked about some of those, but we also, all of us were impacted as well by the pandemic, which has now claimed the lives of more than 3.4 million people worldwide and affected countless more. So I just want to end by saying that, as always, our hearts go out to those who have lost loved ones or whose loved ones are currently battling COVID-19, as well as those of you who have been separated from loved ones at critical times when you most needed the support of the people around you and when they needed your support. And I just, again, to acknowledge, it's just been an incredibly long and difficult 15 months. I'm happy that we're heading out of it and excited that our strategic planning efforts provide us with some food to feed our souls, but also want to recognize that I know this is the time of the quarter when people are exhausted. So thank you for taking time to spend with us today. And at this point, I'm going to turn it over to Stephanie to help set up for today's presentation with our panelists. Thanks, Stephanie.
Thank you, Hilary, for a really powerful start to this webinar and for reminding us why we do this work, and for giving us this time and space to share some of the efforts of the first year of the 5-year strategic plan. As you mentioned, the plan launched in July of 2020, last year, after 9 months of planning by staff, students, faculty, and partners outside of the university. The plan was really developed to focus and unite the school around an internal transformation of sorts, and to hold ourselves accountable to do what we said we'd do. At the center of this plan is the school's commitment to making a public health impact. There are 3 core areas of the plan. One is education for leadership and transformation. A second is methods to research to practice continuum. We'll talk more about what that means and what we've done. A third is collective culture of meaningful change. And then importantly, there are 2 essential areas of the plan that sort of influence and shape all of this work. And that is equity, justice, and anti-racism, and the school's reputation and visibility. And if you'd like to explore the details of each area, you can access the strategic plan webpage here. It's being shown, and then I think there'll be a link dropped into the chat box. And at this link at the webpage, we also track and publish our progress on each milestone, and these milestones are established each year. So the next slide is a partial list of the actions that we committed to at the launch of the strategic plan. You can see here that what we've completed and what is still in progress. And in a super challenging year, we've still been really busy. So notably, we launched the Practice Council and the new MPH curriculum, for example. And then in progress are the anti-racism trainings, establishing research priorities, and finding ways to create cohesion as a school, even as we're all distanced from each other. And then finally, I mentioned that we're holding ourselves accountable to do what we as a collective identified as essential in this first 5-year, or in the 5-year plan. And one of the ways that we're doing this is by asking staff, faculty, and students to help gauge our progress. And we just completed the baseline survey. Almost 650 of you completed the survey. And throughout this presentation, you'll see some of the data and the results from the strategic plan survey, and thank you for completing that. You'll also see screenshots from the strategic plan website. And a big thank you to Kimberly Hay, who's advancing our slides and is the manager of strategic initiatives in the Office of the Dean, for her very smart assistance with all of these pieces that I just mentioned. And we'll have some time at the end for Q&A that I will help facilitate. So feel free to send in some questions as we walk through the strategic plan. Now we'll start with Carey Farquhar, who will kick us off with a focus on education. Carey.
Thank you. Let me show my video. Thank you so much, Stephanie. So I'm really excited to share the Education for Leadership and Transformation core area of the new strategic plan. And I'll be doing this on behalf of Juanita Ricks, who was introduced to you, and India Ernielis, who's the director of the MPH core. They will be co-facilitators in this strategic planning. I'm going to start with a slide. If you can go to the next slide, Kimberly. The desired outcomes that I'm going to introduce to you here are listed on this slide. I'll talk about each of them in a little more detail, and then go into a few of the activities that are in progress as well as planned for these next 5 years. So the first outcome, which is facilitated by Juanita Ricks, is to offer students consistent academic, professional, and personal support across all degree programs. And a really key word here is consistent, because we know that excellent support is being provided to many, but we also are concerned that there are gaps, and that's something we want to address with improved coordination and better operation of services. The second desired outcome during this 5-year strategic plan period focuses on student financial support, and specifically states that SPH will adopt practices to ensure that students have the financial support they need to complete their degrees. And then the third outcome is a commitment to delivering high quality, evidence-based education across all degree programs. and I'm working closely with India on that, as well as with Liz Kirk, who's the chair of our school-wide Curriculum and Educational Policy Committee, which is also known as our CPC. So next, I'd like to share with you data and then briefly discuss the activities that are underway. So as Stephanie mentioned, a school-wide strategic planning survey was recently completed. Faculty, staff, and students were asked to rate on a scale from strongly agree to strongly disagree their reactions to specific statements. And in this slide, you'll see faculty responses are in purple, staff in gold, students in silver. And you'll note that while less than half of faculty agreed with the statement that SPH offers academic and professional support across all degree programs, it was very reassuring to see that 73% of students agreed, and close to 1/4 of students actually strongly agreed. However, a quarter did not believe this was the case, and we feel there's clearly room to do better. So what we are doing, go on to the next slide, please, is establishing a baseline for student surveys. Student services through 2 surveys. There's a survey for students which is opened on May 17th, which Juanita can certainly tell you more about. This survey is specifically for students. We'll be putting a link into the chat box for you. There's also a survey for student services staff that's going to be administered in the summer. And to sort of incentivize our students to respond, there'll be a drawing for prizes for these surveys. And we really encourage all of you to take the survey so we can use your input to prioritize the work on student services across the school. So there are also student focus groups that are currently happening, and these will be continuing until June 2nd. And we'll put the link into the chat box for you to sign up for these. Per Juanita, all students who participate in the focus groups will receive SPH swag as a thank you for your time. So another big incentive. And finally, Juanita's team is also working on identifying an appropriate framework for student services and has turned to this Council for the Advancement of Standards in Higher Education for this, which is an organization that pulls together best practices to promote excellence in student services. So we'll be working with that. So while it's really early in the process, there's a lot of great work going on, a lot of information being gathered, and I encourage you to ask Juanita questions during the second part of this session. So now on to the next slide, Kimberly. I'm going to share a little more data from the school-wide survey. This data is relevant to the third outcome, the evidence-based teaching outcome. And what you'll note is that for those faculty, staff, students who felt that they were able to respond, the majority agreed, and they're about 1/4 strongly agreeing with this statement that UW-SPH delivers high-quality evidence-based education across all the degree programs. However, there were about 15% who didn't agree, and we are really committed to shifting this even further towards the strongly agree response. And I'll kind of share with you now what we're doing and what we're planning to do in this area. Next, thank you. So I'm personally really excited to work in this area particularly. We've started to make some progress in 3 areas you'll see here. And the first bullet highlights work we're doing with CPC around student course evaluations. We know that really to provide high quality teaching, it's essential that students are encouraged and given the opportunity to provide constructive feedback about courses and instructors, and that the instructors then review and respond to that feedback, and very importantly, provide that feedback back to the students, let them know that they've heard, and let them know what changes are being made or not being made and why. It's also really critical that student evaluations are done so that we can find out what the concerns from students are around equity and inclusiveness in the classroom. So these issues are being addressed in guidance that was finalized by CPC, which we'll also put in the chat box, the link to that. It's now posted on the SPH website, and it was also the topic of a school-wide Center for Teaching and Learning workshop that was held in March. And we plan to continue to have these types of workshops, probably quarterly, and really incorporate this into training for all instructors, and particularly those instructors who are new to teaching in SPH. So the second initiative in this strategic area is being launched this spring. It's really on promoting anti-racist teaching practices and more inclusive teaching in the school. And as an initial activity, we have a student assistant who's been looking at all the syllabi across the different SPH programs to establish a baseline for inclusion of EDI, climate statements, pronouns, bias concerns, land acknowledgements. So we've already started to identify the gaps, and we'll be sharing these results soon with all the programs and faculty. So we're at the beginning, too, of setting up workshops on anti-racist teaching, so keep your eyes open for that in the fall. So let me just quickly conclude with the third initiative here, which is a very ambitious one. We'll be continuing it into the next few years for sure. It's really focused on providing training for instructors on pedagogical approaches that have been shown through evidence to enhance students' learning experiences. And we'll be using a variety of platforms, workshops, as well as kind of longitudinal cohort-based programs. We'll start with a HighFlex program in July. And now that faculty are more comfortable with online instruction, I think this will be really useful as we think about moving into fall and how we can further build on that. So I will end there. I'm really excited about being able to work more in these strategic planning areas and strategies. And thank you for listening. Back to you, Stephanie.
Thanks, Carey. Appreciate it. Uli, your slide is up.
Great. Thank you, Stephanie. So hi, everyone. Please let me know if you can't hear me well. So the next slide, please, Kimberly. For this KRA, we will be discussing these outcomes, 3 outcomes that you see, outcome 1, 2, and 3. And I present this on behalf of my colleagues, Megan Herman, Lisa Manhart, and Janet Baseman. The first outcome that you see there is that we will celebrate important work across the continuum of methods to research to practice, from fundamental methodologies to the development and implementation of evidence-based strategies for understanding and changing complex health systems. Outcome 2 is that UW-SPH will continue to conduct cutting-edge work in methods and research with priorities implemented according to a roadmap created by the SPH Research Council. And the third one reads, at UW-SPH, deep collaborations among faculty, staff, students, and key stakeholders result in successful models of academic practice. So as you can see across the 3 outcomes, we do have this thread between methods and research and practice. And you see also the strategies for each of the outcomes. The next one. So here is part of the dashboard when you see things that have been completed or not started or in progress. This is related to the first outcome. Work has begun to define a school-wide list of faculty members whose work bridges across all areas of methods to research to practice. During the development of the strategic plan, we were thinking about faculty whose work may bridge at least 2 of these areas. Upon further conversations with the chairs, in school and some other colleagues, it's very clear to me, at least, that we have several faculty members whose work clearly bridges all 3. So we do have many of those faculty members. And moving to year 2 next year, what we plan to do is to really highlight the examples of these faculty members whose work truly define what we mean by this continuum, their stories, their work, hopefully as an incentive or a further motivation for the entire school to move toward that goal that I mentioned to you. Work also has been done to revise the Academic Affairs Handbook for faculty promotion criteria, especially with an eye and focus on the area of academic public health practice. The next one. So this is outcome 2, and this concerns research. This is about research. The Research Council presented draft strategic priorities for research at the SPH All Faculty meeting in October 2020, which many of you are familiar with. Greater input from the faculty, students, and staff across the school was obtained by a survey. It was felt that just limiting it to the all faculty meeting maybe was not sufficient, and a broader input from the entirety of the body of the school was required. So this was done. During this process of priority setting, the Research Council has also continued to work in two important areas: supporting the development of diversity supplement applications through a series of workshops and the development of a web resource, and faculty-student matching mechanism, which is really a tremendous achievement. Lisa Manhart and her colleagues, it's really a wonderful resource for diversity supplements and the matching I just mentioned. And also they have done identifying ways to provide greater administrative support for training grants, which is incredibly important and an engine for research in our school. The next one. This last one concerns academic public health practice. This is outcome 3. Again, really important achievements in this area, an area of increasing importance in our school. Two highlights of the work during the past year are as the following: formation of the new practice council in school. That's a really wonderful achievement. It brings together representatives from across the departments to identify academic public health practice, associated needs and priorities into school, and also recommending modifications to the academic public health practice section of the faculty handbook, as I mentioned before. And the last slide. And this is just a snapshot of one of the many findings of the survey that both Stephanie and Carey mentioned. This pertains to this specific question. Do you feel like our school recognizes important work across this continuum? And the results were fairly positive. As you can see, many of the results cluster toward strongly agree. Of course, we have a lot to do still in the next 3 or 4 years, but these are good benchmark or good baseline data for us to continue to make this a reality. Thank you for your attention. I'm happy to answer questions later.
Thank you. Uli, collective culture.
Hi, thank you, Stephanie. Okay, let's go to the next slide. Like all of the other groups or other areas, we have our outcomes and we have our facilitators. One of the things you're seeing here is that several of these facilitators are playing dual roles, because Megan Herman shows up again and the ever-present Juanita Ricks, who is doing multiple things. So we have had a number of discussions about what we're going to do and what we are doing in this change or culture of meaningful change area. And I could go through all sorts of numbers and things for you. I'm not going to do that specifically for the reason that we have made lots of interesting progress and there are interesting benchmarks, but this whole area, if you look in the lower right-hand part of the slide, is really where the story is. When you look at the strategies of outcome 3, that we wanted to move into a new space and consolidate our work, and then we wanted to reconnect after COVID-19, those are kind of cute little stories that just the whole world changed on us. So much of our year this year has been one of adaptation and change. And I won't go into all of that because you have all lived that. And it has been a remarkable year in terms of these two little simple statements and how different things played out. So our reconnection after COVID-19 has become a much larger set of things that we're doing, and we are still in the midst of doing those because we're still trying to figure out even how to bring people back into this new building and back onto campus in any meaningful way. So what was thought of as a sort of a 2-week interruption obviously has become something very different. In terms of the strategies and the outcomes, it's still here and it's still something we're working toward, because I don't think any of that changed for us. Just the mechanics and the dynamics changed. We will still be working on reconnecting after COVID-19, long after COVID-19 is gone. It's part of building this culture of well-being and connection. And COVID-19 has given us an opportunity to practice how we do that in some different media. Moving into a new space and consolidating and all of that, obviously we're also going to come out of this, and some people are going to move and other people are going to want to work a little bit more from home, and other people have figured out they can work remotely, and we're still trying to figure out how to do classroom instruction, both in the classroom and then how to accommodate students who may not be able to make it. So in terms of what actually happened here, it's not like we have the exact outcomes that we started with, but we still are moving toward the same place that we wanted to go. If I backtrack up the slide back to outcome 2, the student-centered culture, I think Carey covered a number of those things, and in terms of the projects that are beginning right now, so I won't cover those again. And in terms of outcome 1, the SPH culture that supports ongoing development and growth, the faculty comp plan certainly has been in place, and we are still working on making that better. And the next step is the faculty development plan, and also for the staff development and onboarding plans. So those continue to be things that we will be working on, and I invite you to go to the web pages to see the actual documents of the data of how we're doing, and all those other updates. And we'll be happy to answer questions as we go forward. Thank you.
Hi everyone, I'm Megan Ingram, the Associate Dean for Advancement, and I go by she, her pronouns. If advancement is a mystifying term to you, allow me a moment to unpack it. Please, next slide, please. In UW Advancement, we focus on fostering public understanding and pride in our institution, otherwise known as marketing and communications. We serve and engage alumni, also known as alumni and stakeholder engagement, and we develop and enhance lifelong philanthropic relationships with the university, also known as fundraising. We approach these goals through an integrated model that brings the 3 legs of the stool together. And our school recently reorganized our SPH advancement team in the Office of the Dean, bringing together the fundraising and communication functions under one umbrella. This was an auspicious move, as it tracks nicely to our outcomes in the Reputation and Visibility KRA. And I'm excited to share our progress with you today. Next slide, please. You can see from my slide here, we have 3 distinct areas within this KRA where we'd like to continue to make progress and from which we can evaluate our success. For me, I view these outcomes in 3 distinct ways. I see outcome number 1 as the what. It's about our identity. What is the external facing identity story we want to share with the world? How do we want to be recognized inside and outside of our school community? I see outcome number 2 as the how. This is about our school-wide centralized, decentralized communications and operational model. How does this model advance our priorities and help us meet our objectives? How can it be strengthened? What are the opportunities for improvement, and what gaps need to be filled or serviced differently to be more strategic, coordinated, and effective? Outcome number 3 is the who. This is about relationship building. How do we engage our community in a meaningful way? How do we demonstrate our impact? How do we inspire people to invest their resources in our work? Next slide, please. This year, in order to help us answer some of these questions, we re-engaged the services of Pyramid Communications to assist with assessment, process facilitation, and creation of recommendations around the 3 following areas: strengthening our school's brand, through the development of a unified narrative, evaluating, benchmarking, and providing recommendations relevant to our current centralized, decentralized communications operational model, and helping us to develop a strategic and tactical marketing plan for the school. The slide you're looking at gives you the general timeline and sequencing of activities that we're doing with Pyramid this year. And you can see right now, we're in a dark gray box, which is focused on our brand narrative and messaging testing. But we've been really busy up to this point. We completed an internal communications audit and a competitive comparison with other schools of public health. Essentially, we wanted to look at what we're doing, and we wanted to look at how other schools of public health organize their marketing communication advancement efforts, both from a staffing and a production standpoint. In late April, we deployed a reputational survey to external audiences, asking about their perceptions of our school and testing some of our assumptions. This went to alumni, donors, volunteers, community partners, policymakers, and prospective students who applied to our programs but decided not to join us here at the UW. The response rate has been very encouraging. As of today, we have over 200 completed surveys. Informed with these responses, our next step is to engage stakeholder groups in brand strategy sessions. These sessions will use a suite of activities to get folks talking about what's at the heart of UW SPH's work and identity. Next slide, please. I think the most telling outcome of the strategic plan baseline survey for this particular KRA is that folks are not sure what we're doing as a school to engage our alumni. It can be hard to track this level of activity around alumni engagement because it happens centrally at the department and program levels. We currently organize a quarterly meeting at the central level to share and coordinate activities at all levels of the school, but work is done broadly across different positions depending on staffing scenarios. We're in discussions currently about what it would take and what it would look like to have a central staff function dedicated to alumni relations, working as a central node to enhance both the student experience and our advancement efforts. Centrally, we create quite a few opportunities throughout the year to engage with our alumni. All alumni are invited to these bi-weekly webinars to stay informed and updated. They receive copies of the SPH magazine, published twice yearly, although this year it's going to be one massive double edition celebrating our anniversary. Very excited about that. They're invited to join school events like virtual town halls and lecture series, and campus-wide events like Dog Dash and Husky Giving Day. This year, in coordination with the 50th anniversary, we launched the SPH Campaign for Students. This is a fundraising campaign to raise money for student tuition and programs that support students. This straightforward campaign is designed to encourage alumni participation as donors with gifts at any size. We're always open to creative ideas from the community, so please feel free to contact me with your observations or suggestions. I can't promise that I can implement every great idea, but multifaceted challenges like this can always benefit from a bit of crowdsourcing. I look forward to your questions. Thank you.
Thanks, Megan. And we'll round out with Victoria.
Hi, good afternoon, everybody. Thank you so much. It's been really wonderful to hear everyone's presentation. My name is Victoria Gardner. I go by she, they, sha pronouns. And I'm presenting on behalf of our wonderful, brilliant EDI team that includes Awa Kone, Ruki Hartman, Shanice Owens, Erin Dwyer, and Amra Hamribuddin. And I'm also presenting on behalf of Megan Herman on this KRA. And we work together on many of the equity, diversity, and inclusion work across the school. Okay, so next slide. We have 3 outcomes for equity, justice, and anti-racism. And all of these outcomes were developed pre-COVID And we were in person when we discussed these. And so it's really exciting for me to be able to come back and report a year later what we've been up to. On outcome one, our outcome one reads about our commitment to the EDI roadmap to be implemented, and our progress is shared with key stakeholders, increasing our visibility and reputation as a school that prioritizes equity, diversity, and inclusion. I am going to put the roadmap on the chat that is accessible on our SPH website, so you can find it there. The EDI roadmap is a guide for us on actions we can take across departments, across units, across teams, across our programs around climate, the curriculum, recruitment, retention, data, and how, and how we strategize to accomplish the goals that we set in place in those areas. Outcome two has to do with incorporating principles of anti-racism into our work with guidance from community members. And outcome three has to do with our commitment to build structures and policies in place at the school and improve to facilitate the recruitment and retention of underrepresented faculty and staff, especially those from Black and Indigenous groups. Next slide. So I'm happy to report that for our year one outcome under our EDI roadmap, we are on track. We have made some progress in our accomplishments of the EDI roadmap. We are in the current process of updating our goals. We like to see the EDI roadmap as a living document where we can make edits and changes depending on what is needed at the time. And like I said, we wrote the roadmap in 2019, and so we are in the process of updating it. And the timeline on this is that the EDI committee, which works very hard to carry out the objectives in the roadmap and the departments that they represent, we will be working on updating that over the summer. It's a work in progress. Next slide. Outcome two has to do with community members and principles of anti-racism being incorporated into our work. And so some of the milestones that we have identified for this outcome include continued progress to hire a director for ARCH, the Center for Anti-Racism and Community Health. And I'm happy to report that we brought in 4 fantastic candidates for ARCH director. And we are in the process of making an offer and negotiating with one of the candidates. And we hope to make a more formal announcement very, very soon. So watch out for that. Our next milestone is the establishment of student affinity groups. We've always had student affinity groups in the form of our student of color in public health, our undergrad group, as well as the students of color affinity group for graduate students. And those have been on varying, because of COVID, some of the activities have changed, but our support has not changed at all. Another thing to add to this and why we said completed is because we've also established affinity groups for faculty, staff, and students that are race-based and are meeting monthly. So if you are interested in participating in any of these affinity groups, which I encourage you all to do, please watch out for an announcement in your email that opens up registration once a month for this. We've also started rolling out and implementing our anti-racism trainings. The trainings began in November. And if you recall, we have 2 sets. We have the 1A and 1B for a total of 6 hours of anti-racism training for each and every faculty and staff and student in the School of Public Health. Because of our schedule and time and COVID and all of that, we had to prioritize the rollout for the anti-racism training. We're happy to say that in the last fall and winter quarter, we have trained 41.7% of staff. That's from a sample size of 717. And we have trained 203 faculty, or 55% of faculty, out of a sample size of 368 primary faculty appointments in the School of Public Health. That's for winter and fall. That's for 1A. And for 1A students, we've only done one in the spring, and it was a little disappointing. Looking forward to having more of our students participate. We had 25 out of 284 possible PhD students who attended our first training. So many thanks to the students who've been able to attend, but we will be rolling out some more 1A trainings for students in the summer and in the fall, ongoing. Every year, every quarter. Let's see. We also have continued offerings, which is sort of what I was referring to. We're continuing to offer these trainings. We also have an evaluation plan, which Shanice Owens, our wonderful RA, is in charge of, and we'll be sharing some of the evaluations with you in the future. We use the evaluations every single time we do our training, and we use those to inform formatively how our trainings are going. And of course, we will continue to provide anti-racism training to all of our incoming students, to our incoming faculty and staff as part of our onboarding process, and we'll be working with HR and other folks on that. The next outcome is something that I work with Megan Herman on in HR. And so this is outcome 3. And this has to do with our recruitment and retention of faculty of color, especially Black and Indigenous faculty. One of the things that we're doing is to a really very basic start to this, which is providing bias training and best practices training for faculty search committees, getting better on how we use rubrics, how we're mitigating our bias in the process, et cetera. And that's been going really well. I pretty much meet with all the faculty search committees that are doing searches in the beginning of the year. We also supplement that with training from Chad Allen in our faculty advancement in the provost office. All staff HR managers attend an anti-racism training, as noted above. That is in progress. We're working on that. And we're also working, or going to be working on, it hasn't started yet, but we want to develop a diversity hiring toolkit. And that is something that we'll be working on to be able to provide to you and roll out as well. So those are things that we still have to do. And I think I will stop there to see if there are any questions, and look forward to hearing from folks.
Thanks, Victoria. I invite the panelists to turn on your video, and we'll enter into our Q&A. I just want to express appreciation and really how impressed the amount of work that's gotten done this year in spite of it all. And I was going to ask about what you anticipate to be the focus of your work in year 2. I first want to back up to a question that Megan Oxley posed specifically to Victoria. Are the numbers or percentages of students, faculty, and staff who've completed the anti-racism trainings available online somewhere? The numbers went by too quickly for me to write them down.
Yes, I'm typing it on the chat right now, but no, not yet. But that's one of our projects for the summers. We need to figure out a place where our training modules will need to go, and the schedules and all of that. That's just something on our to-do list. But yes, I'm providing that on the chat as well.
Great, thank you, Victoria. Thanks for the question, Megan. And India asked a question which I actually had typed up myself during the conversation. Ali had touched on the practice council, and I see that I think Janet has joined us now. Could you share a bit more about the practice council? What it is and what it's been focused on? Hi, Janet.
Hi. Yeah, thanks for that question. So when we were thinking about the methods to research to practice continuum for strategic planning, we realized that there was already a research council that had been brought together by Lisa Manhart, and it had representation across the school, kind of thinking about the issues of research priorities and research supports. And we didn't have a parallel group for practice. And so, it was really just me, as the associate dean for practice, kind of in a visible role, which didn't really make sense given the fact that we were really wanting to bring together the diversity of practice work that's done across the school and kind of the diversity of perspectives that we have from our different departments. And so we just formed in fall. And if you look at the website, our priorities were really, because we were new, they were focused around the strategic planning objectives. And so one of the things we knew was a priority for the school was supporting faculty council and thinking about revisions to the academic public health practice content of the academic affairs handbook. And we also realized that we're a little hamstrung in some of our baseline data that we have about practice activities in the school. So another big activity we've been taking on this year is creating a faculty partnership survey. And if you're a faculty member in the school, you will be getting a link to that in the next week or so to kind of better understand the landscape for faculty engagements with practice partners. And then we've also created an inventory of student opportunities that interface with practice in the different curricula across the school. So those are some of the activities we've been doing so far with the new practice council, and we'll love to continue to get feedback and let you know what we're up to as we move along. Thanks for the question.
Thanks, Janet. You can hear sort of a recurring theme here that we have a lot of surveys out there. And that is, I'm sure that this comes as no surprise to those of you who are on the webinar. This is intentional because we wanted to make, for this year of planning, we wanted to make sure we were making informed decisions, which with as much input as possible. Since we're not face-to-face, this is one way to gather information, either through focus groups or surveys, and to have the data that we receive and the way that you answer help drive how we prioritize our work and our time. So again, thanks so much for showing up for focus groups and completing the surveys. This has been a pretty data collection intensive year. Karen Levy asks, what kind of fundraising efforts are underway to provide additional funding for recruitment of underrepresented minority students and faculty members? This seems like a great opportunity in the current climate.
Happy to answer that question. So fundraising is a 24/7 endeavor. We just completed a campus-wide campaign, but fundraising never sleeps. So I will say that the school has prioritized student funding as the #1 philanthropic priority for the school. This was the impetus for the SPH campaign for students. I dropped a link into the chat that can take you to read some more information about that on our website. I encourage you to read the brochure that was put together. It talks a lot about our obligation as a school to make sure we have a diversified student body that better reflects the constituents that our students will go on to serve. Student funding can be used in two ways, and it's really up to leadership to decide on the strategic direction of how funds are used. They can be used to retain current students and to help them with their educational journey, and it can be used to recruit students. So there's different needs in different departments depending on different scenarios. Additionally, same with faculty. So we endeavor to raise endowed professorships and chairs. They're quite expensive, so that sort of limits our pool of people that we can really engage around those conversations. But that being said, there are still people who want to invest in faculty, knowing that an investment in faculty is also an investment in students. So the work goes on and the work continues. So thank you for that question.
Yeah, thanks, Megan. Deepa Rao asks, might you talk a bit more about mechanisms for faculty staff, student accountability on DEI initiatives? Victoria?
Is this a question for me?
I believe so.
Okay. Yeah, thanks, Deepa. I think it's a very good question. There's no perfect answer, in my opinion, as of yet. We're still working on it. I think the EDI roadmap is a really important tool for us because it provides some sort of transparency for what we're doing and what we're supposed to be doing and how we're meeting our goals. So I really am really, I consider the EDI roadmap as an important tool in our toolkit to help keep us accountable, not just to our team, but to each other and to the entire school. We also have reporting mechanisms around bias concerns that are shared with chairs and department leaders so that they have an idea of some of the concerns we're getting from our communication. Juanita and I receive and hear about a lot of the bias concerns that may be reported through our forms or through our DC Info website. Part of the EDI roadmap is also encouraging all of us and really expecting maybe all of us to commit to integrating EDI into our own practice. So how do we integrate EDI into performance evaluations, into our courses, into how we plan events? These are things that we have made room for in the EDI roadmap. So I really encourage people to take a look at it and to see some of those concrete steps that you can do. And of course, that's not all of it. And certainly if there are other ways that we can have a climate where we are practicing a community of care, and compassion for everybody as we are all on this journey together. We're all learning and nobody has the one right answer to everything. And so being able to practice grace and compassion and humility as we engage in this journey together is really, really important.
Yeah, thanks for Victoria for the response, Victoria. Also reminded me that we're not doing this work alone, that each of you sort of represents a broader body of work, faculty, staff, and students who are working on these various areas, and that there are so many opportunities for involvement. So, for example, the questions that have been asked, if you have ideas about measuring or tracking accountability, or if you have ideas around student funding for underrepresented minorities, share them with us. You have our contact information. You know who we are. Those various individuals who are facilitating the areas of the strategic plan, reach out to us. We're really open to input and co-facilitation. Lots of opportunities. Carey.
Oh, yeah, I wanted to add to that there is a school-wide competency for students, and the CPC and all the program directors have been actively engaged in conversations as to how we can ensure that students are able to meet that competency. Certainly MPH undergraduates already are meeting it, as Hilary put into the chat there, but there is a gap there. And so that's also on our radar. Thanks.
I have another question, but I think, Hilary, is it time to wrap up, or do you want me to ask my final question?
If it's quick, you can ask your final question.
My final question is, students generally agreed that University of Washington offers quality academic and professional support, the School of Public Health. Are there particular areas where you think will focus improvements for year 2? This might be for Juanita or Carey.
Do you want to go ahead, Juanita? I don't see the question, which is also making it a little difficult.
I'm going to unmute myself and add that I think that we have been looking forward to particularly dive into and better integrate career services for students across the school. We recognize that this is a clear area for attention and expect that we would prioritize that.
Yeah, thank you.
We were just discussing, Stephanie, around EDI have really risen to the top of what we want to be able to do, in addition to all the student-centered active learning that has been a priority for a long time, but kind of put on the back burner with COVID. So once we get back into in-person teaching, which we're super excited about, we can, reignite that enthusiasm around having, very active, student-centered education, which I think will make it go a long way. Thanks.
Great, thank you. I really appreciate the focus on reigniting. Thanks, each of you. Hilary?
Yeah, thanks so much to all of you and to everyone who participated both in the planning process and has continued to engage during the implementation phase. And hopefully you guys will continue to engage. Stephanie, my answer to your question, obviously I love all of the strategies and outcomes, but prime in my mind is under the culture of meaningful change, that really this challenge that we have ahead of us in the coming months in terms of coming back together in person in the aftermath of COVID, and how we do that in a way that makes people comfortable and happy to be back in person. So we are definitely focusing on that. So with that, I will go ahead and wrap up and say, I hope that all of you will join us for our next webinar, which is scheduled for June 2nd at our standard time, 3 to 4 p.m., which is our 2021 Awards of Excellence celebration. So we'll be recognizing outstanding students, faculty, and staff who are winners of those awards and celebrating all of their accomplishments during this last year. I also wanted to mention, because we got requests from people at the end of the last webinar, and we promised you we would do this, that we are planning later in June, probably on June 30th, to host a webinar that's dedicated to sharing an update on our plans to return to campus in the fall, with a particular focus on what staff should expect about the return to the workplace. We're pushing that out to the end of June because there's, as you saw from Anamari's message yesterday, there's a lot of flux going on right now in terms of policies and recommendations from different agencies. And so I know everyone is eager to get sort of the plan settled. But I guess I would ask you all to treat yourselves and each other with grace and recognize that we still have a little bit of upheaval to go through. And I know everyone is really consumed with just finishing out the quarter. Hopefully people can sort of focus their energies on getting to the finish line of this quarter. And then we will recenter our energies on coming back together as a community and figuring out next steps. So with that, thanks everyone for being part of this and for joining us, and we'll see you in a couple weeks.
Thank you.
Thanks, Kimberly, for doing a great job of moderating.
Thank you.
Yeah.
Thank you, Ashley.
Thank you, Stephanie.
And Ashley too.
And Ashley
Bye.
Salazar behind the scenes.
Salazar, yeah, thanks.